Hi, good evening, CAP seniors. I am senior member Jason Witcher, and tonight I'm going to be discussing the first aid kit and what types of stuff I have in my first aid kit. Now, the importance of having a good first aid kit are the causes of preventable deaths. In cases of trauma, there's about 20 to 81% are preventable, depending on type of injury and where it's located at. So, of those, the ones that of preventable, 33% were hypovolemic. 8% were pneumothorax or penetrating chest injuries, and 20% of those deaths occurred in less than 10 minutes. So responders had less than 10 minutes to save that life. Then another 52% occurred within 11 to 15 minutes. So 72% occurred within the first 15 minutes of the injury occurring. So it does not give a lot of time for first responders to respond to that. So all of us could be a first responder. We could witness a bad accident, a car wreck, something happening, and we're on the scene, and so we need to act accordingly. Now, so in my case, I usually carry about 2 first aid kits. One's with me all the time, the other one's usually in the car nearby, so oftentimes I have 2 of them nearby. And in that, I have, on my thought, I have things that go for the first thing. The big thing is 33% hypovolemic shock. That is losing blood, typically through an extremity. So that's the ones that we can prevent. So for that, I have tourniquets, 2 in this case. I have what's called an Israeli dressing, and it looks like this when it's well wound out. And basically this is a big ACE wrap with absorbent material and a pressure bar here to help provide direct pressure onto the wound to stop bleeding. Then I have my trauma kit by QuikClot, which has as a QuikClot powder, which is a hemostatic agent and helps to stop bleeding chemically wise, plus gloves and a bandage and all that in this to help chemically stop bleeding. Next, I have my compressed gauze. It's in a Z-Pack, which when it comes out looks similar to this right here, and this is for packing into the wound. Next, I have tape. This I have my NPA, which is the other percent. The other one, which is 8%, was airway injuries, so this helps to keep your airway open. I have an NPA here, nasopharyngeal airway. And then, of course, on the other side of that, I have this right here. Can be a non-occlusive dressing. Open this up, cut the edges, and then I can apply that to the chest wall of someone that has what's called a sucking chest wound. Then I have my gloves for protection, and that's it for that. And then in here I have pretty much the same thing, except for I have a couple different types of tourniquets. It's a little bit bigger, and a couple different types of hemostatic agents. One I like to use is Chitosan, as well as QuikClot, because sometimes QuikClot doesn't stop it, but Chitosan will. Otherwise, that's pretty much it for a first aid kit that I keep. I don't keep a lot of stuff. It's just small stuff, quick to the point. I'm going to stop bleeding, and I'm going to correct airway the best I can. If it can't be solved with duct tape or super glue, and this right here, they need a lot of help. We're sending them to the ambulance. Thank you for joining us. We're going to set up a discussion on this through the senior members, through senior member Lieutenant Roth and Chamberlains, and they were going to have a way to do that. I don't know the name of that yet, but we'll have it set up. Thank you for joining us.